Hi, my name is Brenda Lormel Raymond, oncology nurse practitioner, founder and lead consultant for VDI, a healthcare consulting company. In the United States, breast cancer remains a major concern, impacting countless lives. Breast cancer is the second leading cause of death among women, claiming thousands of lives each year. Black women are particularly affected. Today, we want to emphasize the importance of mammogram exams. Breast cancer affects millions of women nationwide, but early detection can save lives. A mammogram is a simple, non invasive procedure that can detect abnormalities in the breasts before they can be felt. By scheduling regular mammograms, you're taking charge of your health and increasing the chances of early detection, which leads to better healthcare outcomes. We urge all women, especially those over the age of 40 years old, to prioritize getting their mammograms. It's a small investment of time that can have great impact on your health. Let's unite as a community to support and uplift all women in this battle.
Hello, this is Bishop Tony Branch, and welcome to MCTV. Today we are going to be spotlighting the BMC's Brockton Behavioral Health Center. This is their commitment to mental health services in the southeastern region. And let me tell you who I have in here. Nationally acclaimed, nationally recognized leader in behavioral health, Tracey Weeden, Executive Director of the BMC Behavioral Health Center in Brockton. We want to welcome you to the studio. That was very long-winded. Do you prefer for it to just be called the Brockton Behavioral Health Center, or you want the BMC name in there?
Yes, well, we are BMC, but we actually call it BBHC.
Oh my
So we
goodness.
can-
BBHC. So I'm going to try to use that.
Yes.
So, well, welcome to the studio.
Thank you.
Listen, and you are actually, I did looked up your bio. You are really nationally acclaimed in the work that you're doing. We appreciate you. And can I say this? I'm going to say this may be a little bit
Sure.
uncomfortable. And we're glad to see our folks doing this type of work.
Amen.
It's so important
Yes.
because of the taboos in our community around mental health. So we welcome you to have a great conversation today. So like I tell folks, it's going to be a back and forth as if you are in our dining room or our living room. So it'll be very, very comfortable. But I look at your resume and I see social services, mental health, substance abuse prevention in communities. You are a familiar face to us, but you may not be a familiar face to others.
Yeah.
Tell us a little bit about yourself.
Sure. Well, first, thank you so much for having me today. And it's really an honor to be able to have this opportunity to pay forward to our communities and to really everyone struggling
Yes.
or experiencing a behavioral health issue. So I come from very humble beginnings. I grew up in Providence, Rhode Island, and in communities where I witnessed firsthand the impacts of substance use disorder, mental illness, poverty, oppression, and learned at a very early age how to really listen to people and try to gain an understanding as to where people were coming from, and then most importantly for me, how I could help.
Right, right.
So, and I used my career. I've been very fortunate to be able to study social work and social justice, and really leaned into behavioral health and have used my career over the past 25 years to pay it forward.
So, Tracy, when you look at your career, is there anything that stands out? It says, Bishop, I look at my career, this is what led me into social work. This is what led me into behavioral health. This is what led me into homelessness. Anything stands out that you want to tell our audience about?
Yeah, so for me, what stood out the most is seeing people who look like me, who live where I live, my family members, friends, colleagues, fellow students, experience some very life-changing situations because of addiction, mental illness, crisis. And so what stood out for me at a very early age was a feeling of sort of helplessness. And so in wanting to use that feeling of helplessness and curiosity to really change, to be a part of the change and to help people to get better. And so, and that's what social work for me encompassed. It's a very broad field.
Right.
And so, but what's nice about it being so broad is that you can provide direct care. Anyone can provide direct service in social work and do counseling and psychotherapy to policy change. And so I really decided when I graduated with my social work degree to maximize it. In this lifetime, to use it to the best of my ability to really understand people and help people. People that most folks just don't maybe understand or have the time to or the relationship with to really extend a hand and help.
Right. So Tracey, you're Providence, Rhode Island, but you ended up in Sarasota, Florida.
Yes.
So you ended up in Sarasota, Florida as a chief operating officer.
Yes.
And you actually focused on, according to my notes here, really around the affordability of behavioral health treatment. How do you connect? Where's the intersection between affordability and mental health services? Is there a divide?
So, unfortunately, there can feel like a divide sometimes, for sure.
Right.
And I mean, with all of the new research out around social determinants of health and health equity, we are clearly seeing that there is a divide between individuals, Black and Brown communities, especially communities that are experiencing poverty, and access to care. So there is definitely a divide in terms of, like, chances are if you are living in a predominantly Black and Brown poor community, you are going to have issues in accessing quality care. Right, and so which affects mortality rates, it affects family systems, generations. And so the way I tie accessible care and really the managed care into behavioral health is through sustainability. So I think it's so important for us in this field to be cognizant and intentional about creating systems that not only serve for today, but serve for tomorrow.
So Tracey, I have to ask you this question. So you have a career as a psychotherapist, I believe, and you have worked in the private sector. How do you make the connection? What shaped your leadership in the nonprofit sector versus being a psychotherapist? And the reason why I'm asking that is because often, I had a little stint in healthcare, we often would hear that you're a clinician, you're not a manager.
Right.
Right?
Yes.
So tell us a little bit, has this been a stretch for you, or this has just been, hey, hit the ground running?
Yes, a great question.
Throughout your career?
Yes, a very good question. In fact, I worked as a clinician and just even a paraprofessional before I got my master's. For many, many years before going into management and then leadership. And I think the number one driver I would have to say is that, in the connection really, is that as a clinician, you are one-on-one. You are present with that human being who is needing care urgently most times in that moment. And so for me, I think many healthcare professionals experience this. Like, I've witnessed sort of cringeworthy encounters in healthcare and interactions between healthcare providers and patients that probably could have gone a whole lot better. And as a clinician, I was always that clinician who would speak up, who would take ownership of the most challenging patients and really just try to connect with people and get to them to the next stage. But what I realized, it was bigger than that. And we really needed to create systems that truly embraced meeting people where they were at, and in that formed policies and procedures that were holistic,
Right.
that look beyond the person in that moment, which may not be their best moment.
Right.
And that's what drove me as a clinician. I just felt that I wanted to do more. I wanted to really influence policy and change.
So Tracey, and you and I both know we often in our professions hear the word underrepresented in management, executive positions, et cetera, et cetera. In our community service roles, we are just trying to maximize whatever we can do based upon our competencies to help out our communities. And you know, I have a whole slew of questions here, but I'm just going to just ask it off the cuff. What specific challenges? I can only imagine. So, full disclosure, I served 13 years at Mass General, and I could tell you, often, I was the only person in the room that looked like us. Can I say that? I hope Eve doesn't kill me.
Yeah.
And so, what challenges have you faced, and how did you become a success against those challenges?
Yes, great question, and so true, unfortunately. I think we can recognize that it's only been recently that there's been a real emphasis in acknowledgement
On DEI. Yes.
And so, coming up as a woman, a black woman in leadership, it was absolutely hard. And oftentimes I did find myself really being the only person of color,
Right.
or one of few around the table, around the decision-making table. And oftentimes, it wasn't always that my voice and thoughts and ideas were heard, or at least I felt that they weren't heard or taken seriously.
Right.
And so, but I think it just, again, it goes back for me that this work is bigger than me. This work extends beyond my own personal needs or gains. It really is about fulfilling a greater need and hopefully leaving people better off and paving the way for future generations to do this work.
Wow. That's a great segue into aspiring to inspire others. What do you say to folks, or what do you say to our community? What do you say to that young Black or Latinx girl that wants to walk in your footsteps? How do you inspire them? Is that
Great
okay
question.
if I ask that?
Yes, it is. And I actually, in preparation for that, because there are so many things, and what I would say is I have a favorite quote from an unknown author, and it reads, "Go confidently in the direction of your dreams
Wow.
and live the life that you imagined." And I would add that those seeking a career in social services is also go confidently in mission.
Wow.
Embrace what you stand for. And most importantly, the work has to be bigger than the individual. And lastly, I would say that know your worth.
Know your worth. That's important.
Yes,
Know your worth.
absolutely. And social work and the work that we do does have monetary value. And while it's noble and it's heart-driven, it's mission-driven, that doesn't mean it has to be for free.
Right.
Because as we do better, then we can pay it forward to the future generations by investing in their success in future careers.
So Tracey, we're going to delve into BMC's, the Behavioral Health Clinic, but I got to ask you, what's your favorite color?
Red.
Why? We have to know why. The audience wants to know why red.
Red is a power color. Red is a fire color. Red, burns, and that's the passion that drives me in this work every single day.
Oh my goodness, we are so proud of you.
Thank you.
So Tracey, we have the BMC, I'm going to use your acronym, BBHC?
Yes.
Is that the acronym? So tell us a little bit about the services that are being offered, and why did they choose Brockton as the sort of headquarters?
Yes. So great question. As you probably know, many people know, BMC, Boston Medical Center, is a nationally recognized leader in healthcare that operates over 500 medical and now psychiatric inpatient beds. BMC is an academic teaching hospital and also manages many mass health lives in Massachusetts.
Yes.
And so the intention and the drive that lifted up Brockton and opened our doors in October of 2022 was really looking at some of the claims data and recognizing that beyond Boston proper, many of our patients who were receiving care lived in this area. And so because of that, Brockton just seemed like the most realistic place to open. It's only 30 miles from our main Boston
Absolutely,
campus.
right.
We're serving the same members. We are also so very well connected in the region. So it felt natural that individuals receiving care in Brockton would be able to, if that was their preference, also continue care through BMC's primary care centers and other like outpatient addiction treatment and psychiatry.
So the services that are offered are,
So the services offered at our Brockton Behavioral Health Center are inpatient psychiatry and clinical stabilization services, which is a sort of an acute residential short-term program for adults with substance use.
So you all are really covering the gamut of mental health services.
Yes.
Let me ask you something. What does your census look like on a, can I ask that on a daily basis?
Sure. Full.
You,
That's an easy answer.
really?
Full.
I mean, really?
Literally.
Wow.
Yes, we have 80 inpatient psychiatric beds and 21 clinical stabilization services beds. So our inpatient psychiatric beds generally run at a between 90 and 95% census every day. And our clinical stabilization services, which is our adult substance use residential beds, run at between 98 and 100% every day.
Well, so Tracey, you're busy.
Yes.
I'm going to ask you, what would be looking at that census, what would be your wish list? Additional beds?
Additional beds, for sure,
Yeah.
unfortunately, especially after COVID.
Right,
but
right.
also additional more downstream resources and preventative resources. So the resources that sort of thought off one's need for those
Right.
acute level of care in the
Yep.
first place through prevention and education and access, and also downstream resources that allow people to seamlessly move through the system of care following an inpatient admission and truly provide stabilization in the community of their choice, and by avoiding another inpatient or emergency room visit.
Wow. Again, this is awesome work. So let me ask you, organizationally, so we know that you're the executive director.
Yes.
Tell our audience a little bit about how the leadership track works there. So is there like a separate board of directors, or are you reporting directly to the Boston campus? How does this work?
Yes. So Brockton is BMC.
That's
Brockton
it.
Behavioral Health is a part of Boston Medical Center, Boston. So I report directly to Boston senior leadership team, and just happen to be sort of a satellite location intentionally in Brockton. So we share the same board of directors, the same sort of infrastructure and leadership in that way.
That makes sense. I think that the question is birthed by folks looking at it at sort of like the neighborhood health center model, where they have the independent board of directors. That doesn't exist because you're basically BMC.
Yes,
yeah,
we are.
BMC in Brockton.
Yes.
So what does your, and I think you can tell us this, what does your average patient look like? I mean, when I say that, what are they coming there for? Are they between the ages of 18 and 26? Do you have some 40? What does your population look like? Who are you serving?
Yes, great question. So our generally our population consists of adults between, I would say, the ages of 24 and 36 years old. We do, for our inpatient psychiatry services, we can treat as young as 16 years old.
Okay.
And older adults around the age of up to the age of 65 years old. And for our clinical stabilization services, we treat 18 to 65-year-olds. And so so it's just that middle age, really
Right,
adulthood. And ultimately, the individuals that we're treating are people like you and me,
Right.
who have experienced some crisis in their life that has really shifted them from their baseline, from their average daily living, and are requiring more care.
So that's good to know. Part of my responsibilities is to really look at. We're doing a bunch of intake of those that arrive as migrants. They have done travels through several countries. They present with a lot of trauma.
Yep.
Is there a pathway to your organization? A lot of them are uninsured, so there are some challenges. What do you say to CBOs that really require that sort of mental health support offered at BMC?
It's a great question, and I understand the need is growing rapidly.
Yes, it is.
Unfortunately. And so I would say that anyone in the Commonwealth, and certainly BMC is no different, can access an inpatient level of care. Individuals can seek out their local mobile crisis team. Every community has one. And that's a team that goes out and does evaluations in the community.
In the community?
In the community. It can be the privacy of one's home,
Okay.
in a doctor's office, really anywhere the person is needing that care. And that mobile crisis intervention team provides an assessment and can directly refer someone to an inpatient hospital into Brockton.
Yep.
Individuals can also access our services through their local emergency department. If it's a crisis that is extremely imminent, they're at risk of self or others, or failing to thrive, and really need that imminent care, they can also access us that way.
So there's never a question, and I have to ask the financial piece again. Again, a lot of folks are uninsured, so there's not a question I present at the emergency room requires some sort of mental health services, psychiatric, maybe become psychiatric, inpatient. There's not a question of you're out of network, in network. You know these questions.
Yes.
So does that present an issue?
Not for Brockton Behavioral Health Center.
Really?
So BMC is a safety net hospital, and so what we do is, while insurance actually matters more for people with private insurance because they are likely to have to go in network with whoever their insurance carrier is paying for.
Absolutely, right.
And certainly we take most insurances, but for the individuals who are uninsured, we work with the individual in our patient financial services team. And once the person is starting to stabilize and can engage in that level of service, and there's many ways the Commonwealth has to like, apply for emergency care, emergency mass health. I think most importantly is getting the person care, because it's very hard to take those steps if someone is no longer with us, right? Because their mental health or substance use disorder has won.
So let me just ask you, you and I know that we can't do this work alone.
No.
Right?
No, we cannot.
In your role, you've been there, I believe you're going on your 16th or 17th month. What sort of collaborations have you built? Who's reached out to you? You can share with us. We won't tell anybody. You can share with us. What sort of collaborations have you built within the community? We have several CBOs across the city of Brockton specifically, and of course across the region. Are there some partnerships in play right now?
Yes, so I would say, first of all, I have to say, being new to this area as a provider of care, it has been overwhelming to experience the welcoming and inclusion that I've experienced in Brockton. I can't think of an organization, nonprofit or government organization in Brockton that hasn't reached out and been welcoming with open arms, willing to partner and address the needs of the community here. So from, again, the mayor's office to our community health centers, to nonprofit behavioral health centers, to just everyone, hospitals, neighbors.
Yes.
I mean, the community has been extraordinarily supportive.
Well, I'm very, very glad to hear that. So I have to ask some of the, or at least one of the most dangerous questions of the morning. So we know the DEI is under attack, but we also know that it is important that both professionally, personally, and for the community, that people look like us, understand our background, our culture, etc. When you look at hiring at BMC, at BBHC. I have it right.
You
I
got
have
it.
it right, audience.
You got
at
it right.
BBHC. How can I ask the question? How is it okay to tell us a little bit that is diversity important in terms of really looking at your clinical staff, your other paraprofessionals, what we call the downstream individuals? Is that important in terms of consideration for hiring?
It's vital.
Oh,
I
no,
would
you didn't say that.
Yes.
Did you say vital?
I did say vital,
You're
yes.
living dangerously. You know?
Oh, I know.
You're living dangerously,
That's
Tracey.
where the red comes from.
There you go.
Yes.
How vital?
Yes, it is so vital. So we were extremely intentional about providing culturally competent care.
Right.
Recognizing that you can only provide culturally competent care if your staff is culturally diverse
Right.
and competent.
Yes.
So, so we actually, over 66, probably closer to 70% of all of our employees live in Brockton or immediate surrounding towns.
Wow.
Yes.
Oh, we salute you.
Yes.
I'm not going to even ask how you accomplished that.
Yes.
That's awesome.
It is
Wow.
wonderful. It is such a beautiful thing because not only are our patients receiving excellent care, but they're receiving it from people they can relate to. It makes all the difference. For our team members providing the care, these are our neighbors,
Right.
right? We may
Right.
go to church with our patients or shop at the same supermarket, and our kids may share the same daycare center. There's a familiarity
Yes.
that's involved, so there's an investment. It's a different level of investing in people getting better, and that makes all the difference.
Wow. Tracey, that's just awesome work. So we have to go on and just ask, you've been in the role 16 months, 17 months. I know you've done an assessment. Tell us a little bit about something that is successful right now, but what else are you working on in terms of what you want to do for BBHC?
Yes, so it has been, I think, being a new hospital and being able to really ramp up and provide the level of access to care that the community needs, especially in light of losing 22 beds
Yes.
in the tragic
Brockton Hospital.
Brockton Hospital,
Yeah.
right? So being able to bring those beds online quickly, open a brand new hospital, staff it,
Right.
which is a huge feat in and of itself, and then maintain capacity, I think, is our biggest accomplishment because we truly are doing what the community called us to do.
Right.
And so over the next year, I would say our goal is to perfect what we do in the sense of really focusing our attention on being an academic teaching, a part of an academic
That's
teaching
right.
hospital.
Let's not leave that out.
Right? That
right.
is so critical
Right.
for our patients to gain access to the most innovative behavioral health care.
Right.
Right? And they deserve that access, and they'll have that because they're receiving treatment with us at BMC Brockton. And also becoming a restraint-free hospital. We are
Wow.
working hard. And
Oh.
yes. And
Joint Commission's going to love you all. Joint Commission's
Yes.
going to love you all.
Well, our patients are gonna love us, too.
Exactly. Well, yes. That's what's important.
yes. Yeah, and that's important, right? Just providing a holistic, humanistic level of care in a safe, clean, beautiful, carbon net zero emissions
Listen to you.
facility.
And I saw the information around fighting the climate, and I was
Yes.
trying to make the correlation. I was like, BMC is so sophisticated in Brockton. I was
Yes.
like trying to figure out. So thank you for clarifying that. So Tracey, let me just ask you. I know that we got our 1 minute warning, but any closing statements that you want to make regarding the Behavioral Health Center in the city?
Yes, I would say that it's a place where anyone needing care should feel comfortable and confident that they will receive good quality care.
Oh, wow.
We are people treating people. So,
Ladies and gentlemen, Tracey has come into the studio today. Tracey Weeden, the Executive Director of the Brockton Behavioral Health Center. She identifies as BBHC. She's straightening me out on that. Her favorite color is red. power. And she's done awesome work in making sure that the staff reflects the community, reflects the city of Brockton. Tracy, thank you for coming
Oh,
in today.
thank you for
God
having
bless
me.
you. Oh,
Thank
you've been so awesome. It's an honor to meet you,
Same
and I
here.
know that you will continue great work in our city. Thank you, thank you,
Thank
thank you.
you.
Ladies and gentlemen, this has been MCTV spotlighting Brockton's Behavioral Health Center. Thank you. Have a great evening.
Hi, my name is Brenda Lormel Raymond, oncology nurse practitioner, founder and lead consultant for VDI, a healthcare consulting company. In the United States, breast cancer remains a major concern, impacting countless lives. Breast cancer is the second leading cause of death among women, claiming thousands of lives each year. Black women are particularly affected. Today, we want to emphasize the importance of mammogram exams. Breast cancer affects millions of women nationwide, but early detection can save lives. A mammogram is a simple, non invasive procedure that can detect abnormalities in the breasts before they can be felt. By scheduling regular mammograms, you're taking charge of your health and increasing the chances of early detection, which leads to better healthcare outcomes. We urge all women, especially those over the age of 40 years old, to prioritize getting their mammograms. It's a small investment of time that can have great impact on your health. Let's unite as a community to support and uplift all women in this battle.